It gives me great pleasure to wish Cuts for Competition Day, Cuts which has been a pioneer in competition policy and analysis in India, and also they were the ones who did the first study on the health sector for the Competition Commission of India. So to select the health sector as a subject of further study is, I think, very appreciated. And I'd like to wish Cuts on this occasion for the Competition Day on December 5th. Now, the subject which has been selected, competition, and which has been titled as Competition in the Health Sector, is very appropriate. Not only because we're going through COVID now, and it has become so important, and also because of the COVID advisories of the Green Channel regulations that the Competition Commission of India has passed, but it's a very important area to examine further. Second, health is a vast sector. It is so huge, and I find that it is even more vast than the electricity sector because it is not only the concurrent subject, but it also covers so many dimensions of market structure. Monopoly, monopolistic competition, competitive market structures. It covers hospitals, it covers drug manufacturers, it covers retailers, it covers chemists. And it used to be called a social good. Sometimes people have called it a merit good. But personally, I think it's a quasi-public good, which makes it very interesting because being a quasi-public good, the implications of it for pricing are enormous. CCI's venture into the health sector started with all our cases on the cartelization in the Drug Trade Association, the All India Trade Association, and their control over the Retail Trade Association and also on the Manufacturing Drug Association, which meant that to some extent they controlled the market, the prices, and the way the commission would be provided, the public information system, although it did have some positive points as my earlier order showed. There were almost 20 cases, after which, because of the drug cases, there was a lot of interest that grew into the healthcare sector. And CCI also did a study on the healthcare sector. The report is just out. And, just out means a couple of months ago, and it's an extremely good report because it focuses on information asymmetry. And there are 4 areas of information asymmetry that has been identified. And if I may recollect, the one area which has been continuously harped by Cuts is the question of the information asymmetry and the role that doctors play with deciding what drugs to prescribe. And this does have an effect of creating a distorted competition field. It doesn't make it a level playing field, especially when you have a situation of both generic drugs and banded drugs. And therefore, and in this situation, I think there's a lot of work that has to be done. And Cuts is really well prepared for taking up, especially on the question of information asymmetry, which had started earlier. So on this note, I wish Cuts a very, very fruitful year ahead on research, which is so critical and important to the country, that of competition in the public health sector, and where there are monopolies and there is a question of looking at how to be handled it and the entire health sector, the hospitals, all this requires an imaginative approach, which I'm sure Cuts will follow. So all the best.